Hello everyone, welcome to my channel or back to my channel. So today I wanted to talk about a recent thing that you might have heard about in the news. This past Friday, May 24th, 2019, the first gene therapy treatment for a neuromuscular disease was approved. The particular disease is called spinal muscular atrophy, which isn't technically a muscular dystrophy. It actually causes death of the nerve cells that send the signals to a person's muscles to contract. There's different forms. The most severe form has onset of muscle weakness in infancy and a very poor prognosis. The life expectancy is typically only a couple of years. And so they gave children who had this condition the gene therapy treatment, and some of them were even able to walk or at least stand, sit up, which was completely outside the range of expectation for this disease. So it's a pretty dramatic effect. And then the treatment was just approved by the FDA in the US this past Friday, so hopefully it will be made available to people in the very near future. But now, in some of the news stories, this raises a lot of other questions, and I wanted to give a little bit of discussion, not so much what I think about these questions, but just the background so all of you can know sort of what we're discussing and what the situation is. So you can understand what's being said here. Okay, so the first thing to know about gene therapy is, for the most part, it's a one-time treatment. Okay, why is this? Well, gene therapy, as it's currently done, uses a type of virus which, rather than being able to reproduce itself, the virus is made to carry the therapeutic gene that the person needs. So the virus puts the gene into their body, then they have the gene, they're able to make the protein that they weren't able to make before. But their immune system only sees that, hey, there's a virus here. It doesn't know that the virus actually isn't causing harm, it's only going to help them. But after their immune system has been exposed to the virus once, then if you try and give them another injection of the virus, their immune system will react to it and the treatment won't be effective. So it's a one-time treatment. So how long will it last? Well, short answer, we don't really know. It's been tested in many diseases in mice. We know that it lasts at least as long as the lifespan of a mouse, which is only a couple of years. It's been tested in a couple diseases in dogs, but again, that's in dog years. For a person, you want it to last much longer than a mouse or a dog lives. So the only way you're going to know whether it really lasts for 10, 20, 30 years is to treat people and watch them for that long and see if it still seems to be effective. We're not going to know that for decades, and we don't want to wait to treat these children that need it until we know that answer. So we don't really know how long it's going to work. Now, the third thing, and this has been raised in some of the issues which have appeared in the press, is, okay, how much is this going to cost? So the bottom line figure that was quoted in the article from the company that's making the treatment is a little over $2 million for the treatment. Okay, that sounds like a huge amount of money, and it is. But the thing to know about it is that there's currently another treatment for SMA. It works a little bit differently, and it's not a one-time treatment. So if you get that, you have to keep taking it periodically every few months, more treatments the first year, and fewer treatments every year after that. But you have to keep taking about 3 or 4 treatments every year for the rest of your life. Okay, it turns out that the price for the gene therapy, if you spread it out over 5 years, and the company that is making the gene therapy has offered that option to insurance companies. Okay, you can pay an equal amount for 5 years, as long as it keeps working. If it stops working before that, then you don't have to pay the rest of the payment. Over 5 years, the gene therapy and the other treatment cost exactly the same. So, but after 5 years, if the gene therapy is still working, you don't have to pay any more. The other one, you will have to keep paying the same amount every year. So, depending on how long the gene therapy lasts, it might actually be much more inexpensive than the other treatment. But we don't know that. It's kind of like a little bit like the difference between buying a house or a condo and renting a house or an apartment. It's a bigger one-time fee, but you don't have to keep, paying a certain amount forever, more or less. So these are some of the questions. Now, obviously, $2 million or even a few $100,000 a year is not going to be affordable out of pocket for the vast majority of people out there. Now, it turns out that because most gene therapies are already targeted at rare diseases, saying that, well, only the people who can afford them, should have the treatment doesn't work, because if 98% of the people can't afford the treatment, now you're taking a rare disease that's already affects only a relatively small number of people and, say, oh, okay, our market is only going to be treating 2% of those people. So there are going to be a lot of issues kind of with the cost of healthcare, with the insurance system. And another thing I want to mention that is kind of unique to the US is a lot of people aren't going to have the same insurance 5 years from now as they do today. So what if someone gets the treatment today and they or their family have a different insurance 5 years from now, and the company that did the treatment is expecting treatment from their insurance, only now it's a different insurance company. How is that going to be worked out? That's not clear. In a country where there's a national health care system, then really that's not an issue, because your coverage is going to be the same 5 years from now as it is today. But that's not the case in the US. So this is kind of good that all these problems are being raised, because it's only because there is an actual treatment that really seems to be dramatically effective. I've read the paper and the results are pretty amazing. But now raises a lot of other questions that are going to have to be addressed in healthcare, and cost, insurance, how long is it going to last? Is there, if someone does need a repeat treatment, right now the technology doesn't allow gene therapy to be given more than once. That's a research topic that a number of people are working on. So hopefully, if someone is treated today and might need another treatment 15 years from now, by that time there will be the technology so that is possible for them. So anyway, a lot of stuff to think about, but kind of a very exciting event. So hope you're all doing well, and talk to you soon.